Good afternoon, everyone. Welcome to Cambridgeshire County Council Staffing and Service Appeals Committee. The County Council allows filming and photography at its public meetings, so please feel free to take pictures and use social media during the meeting. Can I ask, though, that everyone present turns their mobile phones to silent or vibrate whilst the meeting is taking place? Please be aware that this meeting is being live streamed and that a recording of the meeting will be available to view on the County Council's website. There is no fire alarm test scheduled for today, so if the alarm sounds, I will adjourn the meeting and we will leave via the side doors and use the fire escape next to the kitchen to make our way to the assembly point in the car park. Let's move straight on to item number 1, apologies for absence and declarations of interest. Would the Democratic Services Officer report any apologies for absence?
Apologies received from Councillor Nessinger, substituted by Councillor Whelan.
Thank you very much. And does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest not previously disclosed? Splendid. Thank you very much. We'll move on to item number 2, which is minutes of the last meeting on September 9th, 2025. We're being asked to approve those minutes, which took place on that date, as a correct record. Can I ask any member who does not agree with this proposal to please raise their hand? I see no objections to the proposal to approve the minutes as a correct record, so we will take that as carried. So on that basis, the minutes are approved. And I will sign those now if they're available to do so. Much. On to item number 3, the People Strategy Update. Can I ask the Head of Workforce Policy and Wellbeing to introduce this report?
Thank you, Chair. I will just share this report with the Zoom meeting. Thank you. So the report today provides an update on the progress of the People Strategy Action Plan as part of a workforce update to the Staffing and Service Appeals Committee, and the committee is recommended to note the status of the actions in the People Strategy Action Plan. This action plan is updated twice a year, with further commitments added as emerging priorities are considered and agreed by the Council's corporate leadership team. And we brief this committee biannually, focusing on highlights of progress to date. This report provides the second of those updates to praise the committee of progress, highlight achievements, and to highlight any potential barriers to progress. A reminder that the action plan is structured in 4 themes. Those are attracting you, appreciating you, supporting you, and developing you. And the presentation that I'm going through on screen, and which was attached as an appendix, provides a consolidated update by theme on progress to date, planned next steps, and highlights any potential barriers or issues for awareness. In the June 2025 update, the committee asked me to add 2 additions for this next update, and these have been incorporated as follows. One was the addition of quantitative feedback where possible, indicating relative proportions of positive and negative feedback received from colleagues in relation to activity under this plan, and we've incorporated that wherever possible. And the second was a narrative relating to how we engage with our recognised trade unions throughout this activity. The strategy action plan continues to be delivered within budget. There are no foreseeable financial implications. It aligns to our existing employment legislation requirements. It also complements the workforce elements of the Equality, Diversity and Inclusion Action Plan, and you'll hear more about the actions under that from the EDI business partner in item 5 today. So on to our presentation. The table that you see here, slide 4, provides an overview of the actions that are in progress, which is the majority. Those that are complete, and I will cover more on both of those in the slides today. You will note 2 actions that we have listed in the cancelled column. Those relate to the creation of a bespoke learning centre and a project focusing on people aspects of our buildings. And the cancellation of those under the People Strategy Action Plan relates to the closure of the overarching accommodation improvement programme. So taking a look by theme at the highlights of the past 6 months, we can see under Attracting You that we're continuing to fulfil our EDI commitments in terms of attracting a diverse workforce. We've got that e-learning package around recruitment now available alongside face-to-face delivery, with some numbers on completions there as recorded in the summer. And our guaranteed interview scheme launched for care experienced applicants, with monitoring in place to assess the impact of that. Continuing to work to increase the number of permanent social workers, both in children's and in adults there. And we have seen that vacancies in adult social care reduced through the successful recruitment of 18 apprentices who started in January 2025. And we had 4 new Think Ahead social workers appointed this year. We have been working to review our employee benefits contracts. We've awarded a new contract via the ESPO framework that covers employee discounts, lease car scheme and loans and savings. And those are effective or were effective on the 1st of November. We have also directly contracted a new cycle to work scheme, and that does enable a cashback return alongside the NI savings, and that was based on feedback we had from members when we were going through the procurement approval process for that, for us to identify if there were any benefits we could get in return when we were identifying those contracts. So I'm pleased to say that. In terms of our workforce metrics and our benchmarking capabilities, we have standardised our KPIs, our key performance indicators, to ensure that they can be benchmarked against relevant sector comparators. And we are already reporting on some of the commonly available metrics as part of our KPIs. The work of our retention team provides us an opportunity to hear directly about the experience of colleagues, both via one-to-one conversations and as a survey. So looking at feedback that we have had from new starters in both of those routes, we can see some really positive indicators there. So people who are having regular hour conversations with their line manager, so that's those regular one-to-one opportunities every month. A good proportion of respondents were finding suitable learning resources to meet their needs, and also good response rate in terms of intention to keep working for the council. We've got between a 20 and a 29% take-up rate on those new starter engagement activities. So we will continue to look at ways to increase the take-up there, but it's certainly providing some valuable insights already. On the next slide, we've got an example there of what we are hearing from colleagues in our new colleague survey. So we know that new starters have a good understanding, particularly of our wellbeing offer, really high awareness of mental health interventions. And we've heard from colleagues that we could do more to highlight the Healthy You offer, which is more supportive of physical health. So an example of the ways in which we're using that retention information to understand more about how we can, in this case, highlight particular elements of our wellbeing offer. Really positive to report on this update that we have recently achieved 2 new accreditations as an employer. Adding to our menopause friendly status, we have now achieved level 3 in our disability confident leader accreditation, and we have also a new accreditation relating to being a carer friendly employer, so reflecting strong support there for disabled colleagues and for colleagues who are carers. Highlighting here under our Appreciating You theme that we're starting to see the impact of our work to embed our care values. We have asked some questions in our 2025 employee survey, so I expect that at our next session we will be able to report on the outcomes of that. But an indication from our new starter survey, we've seen that 100% of the respondents to that survey can say how they use our values in their roles. So we are really pleased to see that, because not only does that indicate awareness, it also indicates understanding, and that colleagues are putting that into practice. So we'll see more in our full employee survey on that. This slide highlights some of the ways that we are recognising colleagues, as well as making sure that we have an effective benefits offer. You'll see there that we've been particularly trying to enhance our promotion of our financial wellbeing benefits, and they include salary finance, My Money Matters, and Pensions Awareness Week. And with ongoing updates to our employee benefits portal, we have seen some growth in terms of engagement with that portal, an increased number of visits during the quarter. So we continue to keep an eye on how colleagues are aware of and engaging with our financial wellbeing offer there. Moving on to how we support colleagues. I've highlighted here our inclusion and peer support networks, and the recognition that we've seen through the Carer Friendly Employer and the Disability Confident Leader accreditations really support that commitment that we have to providing those supportive peer networks within the council. Both of those accreditations look at what are the routes we have for colleagues to support one another, as well as be supported by their employer. The graphic that you'll see there looks at our Respect at Work disclosure tool, and we are continuing to see that being used as a confidential channel that colleagues can use to raise concerns. And there have been 29 disclosures through that since the launch, and those are shared with the corporate leadership team to inform action and learning. One thing I wanted to highlight, because it might not be obvious from just that slide alone, is that colleagues can disclose more than one type of incident. So the incidents on that graphic will add up to, or do add up to, more than the 29 total disclosures, because they may have said there was 2 reasons for their disclosure. It's really important that we share with colleagues examples of how we respond to what we hear from them. So in our employee surveys in our employee survey, we have made sure that when we've gone out with the new survey, we have also explained to colleagues in a You Said We Did campaign how feedback is driving change, so highlighting tangible progress in areas such as our wellbeing initiatives, as I've said, the embedding of our care values, and the refreshed and relaunched strategic framework. So that's reinforcing our accountability in terms of responding to what we hear from people. We know the importance of the line manager relationship, so that's equally important in our Supporting You highlights. We have had a focus on promoting the learning available to equip managers to be confident to identify and address wellbeing needs within their teams. And we've seen 196 completions among line managers of the wellbeing conversations learning that is available for them during the reporting period. I've also highlighted here the value of our Schwartz rounds in supporting emotional wellbeing and team connection, and that we've had 281 people attend those sessions during this period. I'll go into more detail on impact of some of our wellbeing offer, particularly in the coming slides. And it is really important that when we offer colleagues support with their wellbeing, we understand how we evaluate the impact of that. So some examples here of the data that we analyse from our employee assistance programme provider, looking at the usage and the impact there. There is a significant improvement that we see in scores relating to anxiety, for example. That is the most common presenting reason for colleagues getting in touch with the employee assistance programme. And the graphic on the left hand of the slide there shows the difference between the start and the end of that short-term solution-focused therapy that colleagues can access, and that there has been a significant impact in terms of the measures of anxiety that colleagues are reporting at the beginning and at the end, and an impact on the severity of symptoms. So we're very pleased to see that. Continuing on in terms of the impact of some of our wellbeing interventions, we've seen 406 colleagues attend our wellbeing hour live in the last quarter. And I've given you an indication of the proportion of positive versus either neutral or negative feedback there. So 82% positive, and some of the comments there, as well as one of the statistics that we see is that 97.5% of participants reported learning something to support their own or others' wellbeing. And that's a really good outcome for us in terms of knowing that those sessions are having an impact for people attending. With our Schwartz rounds, again, some more examples there of positive v negative feedback. And one of the measures that I wanted to draw to your attention particularly is that 87% of people attending our Schwartz rounds have agreed that they've gained insights to support colleagues, service users and the public. It is a unique offer here among our wellbeing offer. Schwartz rounds is unique, and it's really pleasing to see that in attending those sessions and reflecting on the emotional impact of work, colleagues are then feeling that they're going away better equipped to face some of those challenges and to support our community. Looking at our highlights from Developing You, we've noted that we're procuring a new learning management system to modernise our learning infrastructure and streamline those operations. And that is expected to offer more robust reporting capabilities that will support us in our governance requirements and evidencing inspection frameworks. We've also highlighted here the availability of careers conversations with qualified careers guidance practitioners, so that we can support people to feel that there are routes available to them in developing their career with us. Also given some examples there on career pathways that we're looking at in hard to fill areas. It's really important, as I've said, that we know that what we do has an impact, and our learning and development offer is no different. There's been a pilot undertaken looking at inviting individuals from courses to explore their application of knowledge and skills from their learning. And we've done that via one-to-one discussions with those colleagues, understanding how they've done that. So this is now being expanded to be rolled out across a wider range of courses, and the aim there is to achieve a richer level of understanding in terms of how people go on to apply learning from the courses that we offer. I expect to be able to say more on that in February. We have a focus on growing our own workforce through professional schemes, and we've highlighted some examples on this slide. Particularly, we have 69 new apprentices that have started since April. Those are all internal employees focused on upskilling and developing their career internally with us, which is positive to see. Again, in support of the importance of line managers and making sure that they are supported and well equipped to manage their teams, we've developed some new line manager training called Elevate, and we're getting some strong early feedback on that. And we've also highlighted on this slide the ways in which we are embedding equality, diversity and inclusion, including our reasonable adjustment e-learning and our neurodiversity awareness training, so that people do feel well equipped to understand and support their teams. Given you some balanced examples of the qualitative feedback we hear from colleagues on this slide, and that's covering various aspects of our people strategy offer, so well-being, our care values, and some of our learning feedback. This next slide, as requested in June, I've given some more detail here on the collaborative way that we work with our trade unions. So I've given a summary of the ways that we meet regularly with our trade unions, and some of those are at a corporate level and some of those are at a more local level, so that we are hearing in depth in particular areas, and then if we need to, we are talking about cross-cutting themes at an organisational level, be that through corporate joint panel or in our strategic health, safety and wellbeing meeting if matters are most appropriately raised there. I've also given an idea of some of the themes that have been arising in the last few months from our trade unions, including feedback on our ratings process, more information around our employee relations work, looking at drafts of our artificial intelligence use policy, so our AI use policy that our colleagues in customer and digital services are drafting, and we've worked collaboratively with our trade unions in that. And also looking at how we share the impact of our wellbeing offer with colleagues to encourage confidence and take up. So, for example, some of the things I've just showed you, perhaps around the employee assistance programme, giving colleagues confidence that if they do reach out, it will have an impact on them positively. Final slide, some idea of what we will be aiming to do in the next 6 months. So as I said, we will receive the results of our 2025 employee survey. We will continue to improve our benchmarking capabilities to understand our workforce in the regional and national context. I expect to see the result of our reaccreditation for our Armed Forces Covenant Employer Recognition Scheme. We have that new learning management system that we expect to be able to make an award for in January. And we will restart learning activities that were paused due to our enhanced financial controls. So we'll be restarting some of those from April 2026. Thank you.
Thank you very much indeed for that report and for all of the hard work that obviously sits behind it. Can I say first from the chair that it's particularly pleasing to see the council's values embedded and understood so successfully, and mental health support being such a clear part of the onboarding process and well understood and engaged with from that point forward. Thank you too for integrating requests for more information on the balance of positive versus negative feedback. We will now move to the debate, members, if there are any questions or comments. Yes, Councillor Gardner.
Thank you very much, Chair, and thank you very much for the report. Much appreciated. When we were looking at the start of therapy for anxiety, and we can see at the end of therapy, we've got, it's a great improvement. What happens to those members of staff that you've currently got as moderate or severe at the end of therapy? 10% and 8.6, so that's 18.6. So I don't know what percent, how many members of staff that is, but I would just be interested to know what we do when they've got to the end of their first or the end of that therapy course. What's our next course of action to help them? Thank you, Chair.
Thank you for that question. We work with our employee assistance programme provider to understand when we do have colleagues who are presenting with more complex mental health concerns, where they are able to signpost colleagues to. So we won't know one by one what happens with those colleagues because they can access that service confidentially. They don't need to tell us. However, I do know that If at the end of therapy there is still an identified need, then our EAP provider and the counsellor that's assigned to them will be making sure that they are aware of what the other routes are that are available to them. So that might be through their GP or the psychological wellbeing service locally. That would be one of the ways I would expect them to be accessing support. The time that we might know a little more is our managers do have the facility where, for example, someone has been off sick due to aspects of their mental health, for example. If they make a referral for them with the consent of that individual, they will get some indication of the impact of the therapy there and if there's any further support that individual needs. So it's part of the picture, but not the whole picture.
Thank you for that. Yeah, that's good to hear, because just reading that, it just made me think, oh, what happens at the end? Because I wouldn't want to think that a member of staff couldn't then get further, help and assistance going on. But you've clarified that now, so thank you very much for that.
Thank you, Councillor. Councillor Batchelor.
Yeah, thank you, Chair. And to be honest, the majority of my questions have been answered because we had such a thorough introduction to the paper, so that certainly saved me some time. But just two very basic questions, if that's okay. One regarding specifically to the table on page 14, which is sort of a list of actions and an update on what's happening with those actions. I see there were two that were cancelled, one under the supporting you, one under the developing you bracket. I don't know if you had any more sort of detail on that as to why those actions were cancelled, i.e. were they just not deliverable? Was there no appetite to go through with them? Just a bit of detail around that if you have it. And secondly, what was my other question? Oh yeah, so the feedback. So I think you mentioned various sort of piece of feedback from from the various focus groups and staff feedback sessions that have been held. I didn't know if the level of feedback we got, sort of, if that was good, i.e. enough, do we have enough information to actually, sort of properly tell whether these sessions are worthwhile, or if the feedback we're getting can be sort of extrapolated across the council. So I know obviously getting people to engage with, things like this and actually giving their views after the event is difficult. So I didn't know if the percentage of respondents we had was high, low. I've got no context to whether that's good or not.
Thank you very much for those questions. On your first question around the two cancelled actions, both of those relate to our accommodation improvement programme and the end of that programme, which I suspect is not necessarily reported directly to this committee. However, the people elements of that were then brought into the People Strategy Action Plan. So one of those was the intention to create a bespoke learning centre, and the other was about bringing colleague feedback into the development of our buildings under that programme. So they are related to the fact that that programme won't continue at the moment. And then your question around is the level of feedback good and is it possible to extrapolate? Because we are looking at lots of different sources of feedback and listening activity from colleagues, what we're trying to do all the time is put together a picture of what's that telling us in the round. And we do get a different level of responses in various different routes. So I've said that I think our new colleague engagement survey has the potential and is showing us some really interesting insights. But because we are between sort of 20 and 29% response there, we are looking to improve and increase the level of response in that one so that we know that it's more representative in some of our other areas of feedback. So anything we got from our employee survey, for example, we know that there was a statistically significant response rate to the employee survey. Off the top of my head, I think it was 54% in 2023, and we will be revisiting that when we get the responses from this one coming. So we just need to look at each of those areas of feedback and assess what they tell us and how much they can tell us about representation across the organisation.
Okay, understood. Yeah, I mean, I thought 29% was quite high in terms of response rate. So, I'm glad to see that we're not, we're looking for more than that. But yeah, I just wanted to make sure the level of response we're getting is enough to, to warrant action off the back of it.
Thank you, Councillor Batchelor. Any other questions or comments? Councillor Kane.
Hi. Firstly, just want to say well done on all of this, and I think it's really great, especially with the sort of the new accreditations that we've got. I'm just really keen on focusing on the social workers. I know that's a problem nationally, and it comes across various committees that I sit on about the challenge with recruiting and retaining and social workers. So I really like that we've done that through apprenticeships and through sort of reaching out to our agency staff. Do you feel that we've got a handle on it and that the sort of social worker recruitment issue is sorted, or do you think there's more to do, or is there a plan for it? Just basically, can you tell me more about the social worker, the state of the social worker recruitment at the moment?
I think there is always more to do. I think I would have to ask if I could come back with some current statistics in terms of vacancies and where we might need to focus more on there, because what I've got here is quite a high level overview of some of the activities. And as you say, we have been having some success there in both apprenticeships, but also bringing colleagues over from agency. And as I understand it, there has been a good impact there, but I'd like to be able to give you some more specific detail on that. Okay.
Stephen, would you like to add to that?
Yes, thank you, Chair, and thank you to Anna for the response to Councillor Kane. Couple of things to say. First of all, for the benefit of members, we look at this through both adult social care and children's social care, which actually have distinct issues, it would be fair to say. Within adult social care, recruitment retention of qualified social workers has been strong for some considerable time. The County Council took steps a number of years ago to help ensure we were able to continue to recruit and retain well in that area. That particular part of the Council has a very strong professional development offering supported by colleagues in learning and development, and particularly the offer of bursary support within the last 12 to 18 months has helped increase the number of people wanting to come into adult social care. In addition to which, our principal social worker for adult social care has been leading the development of things like our Care Academy. So that's the Cambridgeshire Academy for Reaching Excellence, if my memory serves correctly. That's effectively a learning and development approach for potential social workers covering both children's and adults, but it was created within adult social care. And I think importantly, that reaches beyond the council, because of course, adult social care is not just delivered by the County Council, it's delivered by a number of providers. So that academy now provides support for people to gain accredited qualifications, whether they're working for the County Council or in more broadly adult social care providers. So that's been hugely successful. Turning then to children's services. Children's services, perhaps unsurprisingly, but not unique to Cambridgeshire, qualified children's social workers have been a challenge to recruit and retain, and that's been the case actually since Children's Services was established in 2004. So that's not unique to us. When government changed arrangements, that's continued to be a pressure point. In terms of where we are within Cambridgeshire, I'm delighted to say to members that the rate of use of agency social workers in children's social care has considerably reduced. There is a dedicated children's workforce board that the Executive Director of Children Education and Families chairs as part of our overall approach to children's workforce issues, and that has been making improvements in reducing the use of agency social workers in that area. Ideally, where we can, we convert those agency workers into permanent members of staff, so that not only gives us the benefit of somebody who's been working with us, but actually wants to stay with us. I think probably the thing I would say in conclusion, Chair, actually on the children's social care side of things, perhaps even more than adult social care, I think the reputation of the authority is probably the critical factor. So quite often we would get into debates historically about pay. We benchmark our pay for social workers across the region. We understand we're paying comparatively alongside other authorities. Actually, it's not about pay. It usually tends to be, are people supported? Can they progress? Will they get good professional development? Will their work be valued? And is the authority actually improving in terms of children's social care? Those are all factors that really, really matter. I have to say, since we separated from our former shared arrangements with Peterborough City Council, we have seen a marked change in both the reputation and focus on improvement within children's social care. So I would say that we have seen improvements to vacancy rates, but Anna's opening response was absolutely spot on. There's always more to do. Thank you, Chair.
Thank you very much, Stephen. Do we have any final comments or questions? On that basis, then, we will conclude the debate, and we are asked simply to note the status of the actions in the People Strategy Action Plan, so nothing to vote on further. We will move on to item number 4, which is the workforce update. And can I please ask the Head of People Services to introduce that report?
Thank you. Good afternoon. My name's Caroline Nadubansra, and I'm here to present to you the mid-year update on the workforce demographics and the people-related strategies. And I ask committee to recommend committee to note this report. So just to bring to your attention a few of the items that are in the report, our overall headcount has declined in the last year, seeing a decrease of 70 people. This we think is attributable to the work of the Workforce Expenditure Control Panel, which is providing challenge and rigour around the requirement for new and replacement roles and encouraging services to really consider whether they replace a role or whether they can execute their duties in a different way. Moving on, we've also seen, since we introduced the care experienced motion, and that category has now been added onto our employment system, we've seen 41 people voluntarily disclose themselves as being care experienced. In terms of turnover, this year our turnover figure has remained within our target range of 10% to 13%. Whilst we do see fluctuations through the year, this is a steady turnover rate and considered a healthy turnover rate. So we talk to people who are leaving, and we have a dedicated team who meet with people who are starting in the organisation and looking to leave the organisation. And in terms of themes around why people might be leaving, we're seeing team morale as being one of the reasons, opportunities for progression, and some work-life balance were reported as key factors in their decisions recently. But conversely, the wellbeing offer is widely appreciated as a valuable employee benefit, with people benefiting from the flexibility of the offer and the breadth of the topics covered. In terms of absence, you can see from figure 3.2, the number of people reported as having absences is reducing. We are still seeing short-term absences as the reasons for the majority of our absences. And whilst we support managers to encourage people to take as little time as possible away from the organisation, we focus a lot of our attention on long-term absences, and we are starting to see a reduction in the number of people being off for a lengthy period of time. So the HR advisory teams provides a lot of support to managers and training around how to manage absences in the organisation. And then I wanted to draw your attention to the change management element of the team. So within the HR advisory team, there is a dedicated team providing comprehensive guidance and advice to services to deliver against the people-related aspects of the change agenda. So since its inception 12 months ago, this team has successfully supported 30 services through organisational change programmes. And then finally, the challenges and our areas of focus for the next 12 months. So we would like to continue to manage sickness absence, keep that as a key focus, which is responding to the absence levels within the organisation. Continue to lead the implementation of the organisational design principles and work systematically through the organisation, reviewing structures, realising savings and meeting business planning targets. Continue to enhance the retention of new employees, by proactively applying any insights we gain from our levers and the information that we receive from our engagement surveys, and then actively support the development and skills, knowledge and confidence of our managers with providing bespoke training and embedding learning to make sure they're able to confidently manage the people in their teams. Thank you.
Thank you very much indeed, Caroline. Much appreciated. If you wouldn't mind, I'd just like to ask one quick question from the chair, first of all. The trends that you've outlined in relation to stress, anxiety, and mental health related absences obviously continue to be fairly high in a historical context. I was wondering if we have data on how those trends compare with the population as a whole, both here in Cambridgeshire or indeed more nationally, whether this is something where we are in any way an outlier or whether this is a product of a broader trend.
So we are working on our benchmarking. We have been able to benchmark ourselves against CIPFA information, but that's slightly outdated now. That's sort of 2022. So at the moment, we're working with the data team to find much more comparable data to be able to look towards. But in terms of the CIPFA data, we were sitting sort of within the normal reams, yeah.
Thank you. Now I'd like to open to the floor for any comments or questions. Councillor Gardner.
Thank you very much, Chair, and thank you very much for the report. It's probably me, but it's just if you can clarify, when I'm looking in 2.2, under the head count, when you add up employee relief, then you get a total, the total doesn't add to the employee in the relief. So that would give you then a total of number of staff that is higher than 4487. So I wasn't quite sure what was happening there, unless I've misread it, what have you.
I'm not sure if that's something you want to comment on now, whether it'd be easier to take that away and revert back.
Yeah, I would like to take that away if that's okay.
Fine,
Thank
fine.
you.
It would be just useful to know.
Yeah, sure.
Thank you, Councillor Gardner. Any other questions, comments? Councillor Batchelor.
Yeah, thank you. So I've got a question about that same section around the headcount. I think the very end of or the last paragraph in 2.2, which is page 37, it says that we can see that the highest proportion of sort of age ranges for the 50 to 60-year-olds, and the sort of the comment around that is that this shows that many of the workforce have remained loyal to the organisation. I just wanted to check: is that 100% correct? Because that's sort of assuming that people started their careers with the council earlier and then stayed until their 50s, whereas, you know, that might be the case that they might have joined in their 50s. So I just wanted to know how certain we were about that assumption.
So I can provide some additional information next time around that, but I did look at length of service, and we can see a large proportion of people have been with this organisation for quite some years. But I take your point that that's a sweeping statement to make, yes.
Any further questions or comments? Splendid. Well, thank you very much again, Caroline, much appreciated. We are simply asked to note this report once again, so we shall do so and move on to item number 5, which is the Equality, Diversity and Inclusion Strategy Update. And can I ask the EDI business partner now to introduce that report?
Good afternoon. Hope you can see the slides there. Thank you. So I'm here today to present an update on our Equality, Diversity and Inclusion Strategy, EDI. This strategy is a key enabling strategy for the Council and sets out our equality objectives, a key requirement for us as part of our duties in the public sector equality duty under the Equality Act 2010. Action plan progress is monitored through our EDI governance structure by the EDI Leadership Forum quarterly. It's reported into the Community Social Mobility and Inclusion Committee biannually, and this committee as well. Just a reminder that the strategy has 3 strands: our workforce, our communities and our services, and there's 3 guiding principles which underpin each of those strands. Page 52 of the papers provides a RAG rating, red, amber, green, for each of the actions in each of the themes, and today I'll provide some information on our workforce theme. Pages 53 and 54 identify some of the actions completed since the last update to this committee. Highlights include the submission of the Social Care Workforce Race Equality Standard for 24-25, a programme that aims to identify and address racial inequities in the social care workforce, and the development and launch of neurodiversity at work awareness training in collaboration with learning and development colleagues. As mentioned before, we have achieved Disability Confident Level 3 status and introduced a guaranteed interview scheme for care experience applicants. All of these actions contribute to our requirements under the Equality Act and the Public Sector Equality Duty, as detailed in the slides. Page 55 shows work in progress, including supporting officers to provide reasonable adjustments for customers and working on pay gap reporting for 2025. Reported in 2026. Going into a bit more detail of some of our work, page 56 showcases our work to improve diversity disclosure figures, and this data helps us to understand the impact of our policies and our practices on different groups, and is a key requirement for us under the Public Sector Equality Duty. Page 57 provides an update on some of our anti-racism work, so including the launch of new web pages to support colleagues and events to celebrate Black History Month. All of this work has been led by our anti-racism steering group. And page 58 shows a timeline of the anti-racism work that has been undertaken since 2021. As mentioned before, we have achieved Disability Confident Level 3 status, and page 59 summarising some of our work on this. This was externally validated by Disability Rights UK and demonstrates our commitment to supporting disabled applicants and employees. All of the work showcased in the slides include links to our requirements under the Equality Act and how we're meeting our duties, as mentioned before, under the Public Sector Equality Duty. Page 60 outlines guidance and resources we're producing for colleagues to provide a supportive environment and deliver inclusive and accessible services. Thank you, and happy to take any questions or comments.
Thank you very much indeed, Faye, much appreciated. We will now move to the debate, so any questions or comments from the floor? Clearly suitably comprehensive. We are once again asked to simply note the status of the actions in the Equality, Diversity and Inclusion Strategy Action Plan. So we will do that now. Thank you. I will now move to item 6, which is the Staffing and Service Appeals Agenda Plan. Could I please ask the Democratic Services Officer if there have been any updates to the published agenda plan?
No updates, Chair. Thank you.
Thank you very much, Tamar. Any comments or questions on that plan? We are then recommended to note that agenda plan and will, on that basis, move on to item number 7. I will now read out and propose the recommendation to exclude the press and public for the next item on the agenda. To resolve that the press and public be excluded from the meeting for the following item of business on the grounds that it contains exempt information under paragraph 3 of part 1 of Schedule 12A of the Local Government Act 1972 as amended, and that it would not be in the public interest for this information to be disclosed. This is information relating to any individual information relating to the financial or business affairs of any particular person, including the authority holding that information. Do I have a seconder? Thank you, Councillor Murphy. Can I ask any member who does not agree with this proposal to please raise their hands now? On that basis, I see no objections to the proposal, so we will take that as carried and now have a brief pause while the necessary technical changes are made. Thank you.